You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to a special two-part series of the Pharmacy Podcast Network's exclusive press coverage of ATRIUMX 2025, the first of its kind pharmacy conference that took place February 27th through March 1st in Orlando, Florida. ATRIUMX wasn't just another industry event. It was a collaborative experience bringing together forward-thinking pharmacy owners and industry experts to tackle the biggest challenges in pharmacy today. With co-created sessions, real-world solutions, and a community-driven approach, this conference redefined what pharmacy conferences should be. So whether you were in Orlando for ATRIUMX or missed out on this one-of-a-kind event, don't worry, we've got you covered.
Scotty Sykes.
Yes.
Scotty Sykes should be a hashtag. It should be hashtag Scotty Sykes. Keep yourself out of jail with the IRS with Scotty Sykes.
Hey, that's my job. I'll do anything I can to protect pharmacies and put them on the right path.
Yeah, all kidding aside for our listeners, Scotty Sykes is part of Sykes & Company. It's our accountant that we use at the Pharmacy Podcast Network. You've helped community pharmacies for freaking years through your dads as the Jedi Master of all things, tax and keeping people doing things the right way and strategy. But talk to us about the temperament today, and that is we're at ATRIUMX. This is the first of its kind conference. But what's happening in community pharmacy now, and your company's thriving, but you're also making a difference, obviously, in community pharmacy. Tell us what's happening from your perspective.
Well, the pharmacy industry is constantly evolving, and which is fun, provides opportunities. So instead of looking at the negatives of pharmacy, what are the opportunities? And that's what this group here at ATRIUMX's, their mindset is.
Yep.
Is what are those opportunities? We've got those issues in pharmacy in general, but where can I expand and where can I grow this business? And that's the mindset you have to have in pharmacy. If you don't, you will be behind. You will be not performing where you should. So following groups like this and individuals like this who are thinking outside the box, thinking about diversified revenue opportunities. There's a whole bunch of topics here they're going over: functional medicine, 503B, telemedicine's on the top agenda today, for example. Exploring into these areas, being the healthcare center of their communities, the most accessible provider in their communities as well. So, there's just a whole lot of opportunity in pharmacy. Everybody here would, I think, agree to that. And it's hard, it's difficult, but it's fun and challenging. It's all about taking care of patients.
So you actually take care of your patients, which are your independent community pharmacies, and you guys are the ones that are sitting there being the protectors of tax liability and mistakes and things that they might make. So you and I have talked about this before, adding on new businesses to start giving more services to the community. What is happening in long-term care at home, and what should a pharmacist or pharmacy owner kind of look out for if they're changing their business model a bit?
So for long-term care at home in particular, if you're a pharmacy out there, you absolutely have to explore this area because you're already servicing a lot of qualified patients here. And so, moving into that long-term care at home space and these contracts, better reimbursements in a lot of cases, is really a no-brainer because, again, you're already servicing these clients, or you got to figure out how to service them, because you have to have the compliance piece to it and delivery and things like that. But that's kind of a low-hanging fruit now, and you got to be on that as a minimum in a pharmacy today. And I tell pharmacy owners, you want to get to 50 patients at a minimum, but once you get to 100, 200 patients, you really start to see a difference in margin, and that gross margin that our belief is that gross margin's kind of that number one KPI, key performance indicator, because where that's going to determine where you are, what opportunities you have, where the issues are. It's all about that revenue and that margin. What's happening there. From there, the rest of it kind of falls in place, and but you got to maximize that gross margin.
Mm-hmm. All right, so Master the Margins, one of the podcasts that we love promoting and putting out through Pharmacy Podcast Network. What other resources can you share with some of the listeners of giving them heads up of what's happening and opportunities in their business to save more money?
Well, we have tons of content, Todd, as you know. We got a couple podcasts, 2 or 3 of those. We've got we're accessible. Mm-hmm. If you have questions, you reach out to Sykes & Company, you're going to get a response from me or Austin or someone from our team. If they don't know the answer, they'll push it to somebody who does. We're very responsive. So we're accessible to anybody. We're here to help as many pharmacies as we can, and that's the way we're going to do it.
Shout out to Bonnie. Bonnie too.
Yeah, Bonnie's always willing to help. Those
she
startups
makes the
in
podcast
particular.
like 10% better.
She's the star of the show. I mean, what can I say? And she loves it. She loves.
Well, we love having you on the network.
Yeah.
We love having you overseeing and someone that we can go back to with questions and appreciate it. What's the next conference you guys are going to?
We're going to APC a couple weeks in Destin, so we'll be there. Will you be there?
Look out for Sykes & Company. Check them out. SykesandCompanyPA.com.
Yep, that's right.
All right.
Alrighty. Thanks, Todd.
Fellow podcaster here with me in the booth, Atrium. I had a little southern draw. ATRIUMX here with Dr. Adam Robinson.
Hello, friend.
How are you?
I'm excited. This is what I've kind of been missing for a while. This think tank.
Mm-hmm. It's like a mastermind on steroids.
Yeah, and you know what? I got suckered into talking. And so that's one way you make money in these things is you have these conferences, and then you have all the people that are coming to the conferences speak, and you don't pay them anything. No, I loved it. I loved her idea that she was doing, her and Kelly and Terry and Jen, and it's awesome. There's a lot going on around here. You
bring something to the table that other pharmacy owners may not, and that is, you're a pharmacy student, you're super nerdy, you're scientific, you might be probably introverted. You were telling me about your shyness and some of the things that you went through, but you've transformed into this microphone out there really helping pharmacy owners to understand what's going on. Mm-hmm. But that's part of growth, and that's part of like stepping up, and that's part of being inside the industry to really help it. So when you come to a conference like this, what's your impression of going from something that's already formatted to now coming here and building the content when you get here?
It's a super interesting idea. Mm-hmm. And I've talked about it before on podcasts and when I get up and speak and that kind of thing, but it forces vulnerability. And I have learned that through vulnerability is where we grow. And so when you take an introverted person, or there's a few like brand new pharmacists here that just bought into they may feel overwhelmed. Mm-hmm. Maybe they're not worthy. I mean, there's that. You hear that. Like, I'm sitting around with a bunch of masterminds, and you don't think you've got it going on, but we were all in that same boat. And so Nicolette has done a great job of pushing us to ask questions and to get out of our comfort zone. And people are going to leave. Everybody's going to leave here with growth, and that's pretty impressive. It's been a while since we've kind of had something like that.
Yeah. So what have you heard while we're here that you're like, okay, that really interests me. I'm going to kind of maul that and get that going and bring that back to Save Right and implement?
There's been a lot of stuff that I've heard. I guess my issue that I have personally in my business is a lot of follow through with. I'm a jack of all trades, master of none kind of thing, and that's been really good to hear from other people here that had the same issue and what they did to overcome that. to learn how to take these ideas and not go home and get overwhelmed. I did really good with that a long time ago, and now I'm kind of got a lot of different buckets that I'm doing, so I'm trying to figure out how to do that. But as far as like a single idea, and there's so many good ones. Like I had to just get up and talk about functional medicine. That's still a hot topic. 503B pharmacies is a hot topic we're learning about. There's actually quite a few AI software developer guys walking around here that have pharmacies that are taking some of the platforms we have and making them better. So that's something that's super interesting is this AI, how to use that. I was talking to a good friend of mine, T.W. Taylor. He does functional medicine. He solely uses AI for his scheduling, for his soap notes, for his solutions he offers patients. So AI seems kind of like a daunting 2 letters, but picking these people's brains and seeing what they're actually using, what platform, what service, that's been really eye-opening.
So I want to kind of stop and give a shout out to listeners. You're a pharmacist, you're a pharmacy owner. You need to dip your toe at minimum into some sector, some tool of AI. For me, I consider myself a baby user. So what I do is, and this is a dumb way to use it, but oh well, it's my first venture. I'll write an email out. I won't pay attention to the spelling because I don't care. I throw it into AI. Not only does it write it a little bit better for me, and I can tell it the personality that I want it to write it, but it corrects all of my spelling, and it corrects some of my grammar. So that is my favorite, and I know that's like I'm a 1%er of the 100% of what AI is out there, but at least if you're listening and you do not use artificial intelligence, fire up the ChatGPT, pay the $20 a month because it's a much better environment. If you
is true.
And drop your emails into it, or drop your business plans, or drop your marketing plans, or drop something in it, and I guarantee you'll get something out of it.
One of the things I used for ChatGPT I thought was really cool is I downloaded some reports from my pharmacy software system. So I did a fill search of a certain date range, right? And uploaded that because it is HIPAA compliant. So I uploaded that into it and asked it to show me trends that they're finding in that.
Oh my gosh.
And it just would print out like graphs, or hey, here's your top 10 providers that you may not have noticed for such and such whatever. Like
that is cool.
Yeah, it's pretty cool stuff. So there's a lot of those things that, like, there was another one, maybe they'll pay us, man. Functionalmind.ai, TW was using that one. And that one, you go in and you can upload all your labs, all your soap notes, all your whatever, and it'll spit out a diagnosis and a treatment plan and ways to purchase product. And so, yeah, it's really, it's kind of crazy.
It is kind of crazy. It makes me think of predictive modeling and the ability to apply pharmacogenomics to something and then be able to come out with an exact plan for a patient based on metabolization or something.
We're all smart fellas and gals in here, but we don't know everything. And there's things that we're going to overlook. So it's a tool in our tool belt. So, me and you can sit down and talk to anybody in this room, and ChatGPT cannot, but we use ChatGPT to help us talk to those people. So just remember, just use it as a tool in your tool belt.
All right. Well, Pharmacy Crossroads is entering in a new realm, a new season. We're excited that you're part of that. Shout out to Bruce Nealon and the rest of the Pharmacy Crossroads team. Shout out to Nicolette Matthey at ATRIUMX and what she's done with Atrium 24 and Dottie, and even her use of AI is just amazing. If you're listening and you want to connect with the Workflow Whisperer, Dr. Adam, just reach out to Dr. Adam Robinson on LinkedIn, and he's easy to find. He's out there. Or Google his name, and you're starting to come up because we're putting so much content out.
You know what's crazy is there is an Adam Robinson podcast. Podcaster. Yes. And there's another Adam Robinson that writes books. So if you Google that, you're going to get one of those two guys. So type in pharmacist.
Pharmacist Adam Robinson.
And I'm on there somewhere. I'm on Instagram or Facebook. You can probably find 100% you can find my cell phone on there somewhere. Social security number, all that good stuff.
Open a credit card up, Dr. Adam
please.
Robinson.
And then
use AI to keep hidden.
Right. Oh man.
Well, thanks for stopping by and being on ATRIUMX, an inaugural podcast.
That's the coolest part. Is I was sitting up
You're
there
the first,
and I was like, man, this is kind of small.
Yeah.
And I was at first at Lisa's and first at Nicolette's, and so it's pretty cool. I'm excited.
All right, we'll talk to you soon.
Thanks.
Canol Vias, RX Mile here at the ATRIUMX, the first ATRIUMX. Canol, what are you doing?
A first of many.
A first of many.
Okay. I'm excited. I'm here in my hometown, Orlando, Florida. So
I know you're a cheater. You didn't have to go to an airport. You didn't have to drive very far.
Yeah, very easy. I would say 35-minute drive from the house.
You're so lucky. Being able to sleep in your own bed and then go to a conference, it's unheard of for me.
We got to make this happen every year.
I got to have a Pittsburgh conference, and then that way I can do it.
Yeah, for sure.
All right. If people don't know what is RX Mile, tell us about.
Now.
Everybody does know, but just in case.
RX Mile is the gold standard in prescription home delivery. We tie in with all the PMS platforms with seamless integration, and we are actually launching the pill here in 2025, which are different pieces of features, you could say, that pharmacies can utilize, and we only consider them the pill if it's something that brings value back to them. Mm-hmm. They can, ancillary ways to make revenue, different ways to cut cost, cut payroll, cut, call volume, mm-hmm. different types of things. So we've been working very hard with our development team to start rolling things out that can help the independent pharmacy community here, and excited about 2025.
Well, I'm excited that it's come at the right time that you've blown up like you have, because it's so funny that you're an overnight success, but it only took you 20 years to get here. You know what I mean?
Yeah, 100%.
And what's funny is you've come at a time in the market when long-term care at home is going to be the future of community pharmacy. So having a logistics partner in a community that can do all of the deliveries, the cold packaging for specialty meds, the care, the follow-up, the documentation, the privacy, the professionalism, you can't get that from just any delivery organization. You are very, very tied into the ecosystem of pharmacy, and that's what excites me about RX Mile.
Yes. We're the face of the pharmacy in the sense, right? Whether they're using their internal drivers or they're using a network courier of ours. And, I call it ALF without walls, which is where it's going now. It's too expensive to put a lot of our seniors into these ALFs now, right? So a lot of the industry is going towards that, and we need to make sure that it's efficient. We were built as a platform to deliver to individual homes anyways. We pivoted to make it where we can deliver into ALFs, where we can do batch closeouts of multiple patients with multiple medications, make it less cumbersome for the nurse signing off. But yeah, we're prepared for that, and looking at different technology pieces that we can implement to piggyback on top of what we already have that can help with people who are going to be focusing on that type of delivery.
So what else is being tied into RX Mile? I start thinking of things like patient transportation to the physician's office, or something else that kind of helps the community pharmacy to become an additional extension to community health.
So we're not going to really dive into too much of taking patients to the offices and stuff like that, but diversifying in different ancillary services that can be provided, that's very important. Mm-hmm. Wearable devices, different type of smoke cessation classes, things that pharmacies can offer, but some of these patients don't even know that they offer it, right? Yep. In their mind, they're thinking that this is the place where I get my prescription sent to and I get my medication delivered, or I go pick it up. But if they know that there's more options and things that the pharmacies can provide to them health-related, that's what we're delving into as far as with RX Mile, to be able to provide a technology piece mm-hmm. to make it very seamless for them to incorporate that. Because I tell people all the time that, delivery is the new Netflix, right? Nobody's going to Blockbuster no more, right? Mm-hmm. Everything is being delivered. Everything is being done at the home. at the point of care, at home are two important pieces that we're trying to create the bridge where it's all seamless from the doctor writing the script to the patient receiving the med.
Let's say I'm a community pharmacy owner. I know that 5, 7, 10 miles away from me, a Walgreens or a CVS shut down. And now I know that there are markets out there in my bigger community. If you start drawing the circles around your pharmacy and you go, 3 miles, 5 miles, 7 miles, 10 miles, where does it start getting like, is there an RX mile sweet spot where you're like, hey, if you know of a pharmacy that's shut down, RX Mile can help you expand your territory or your market?
So, with related to that and related to delivery, we're kind of a hybrid type of model in our platform, right? So, we have pharmacies that use it internally with their own drivers, and then we have couriers they can outsource to. We're also looking at implementing a third option button for emergency deliveries that can be utilized by people that can do it right there on the spot. And then tying in a team that can go past 20 miles, that can go past 50 miles. So therefore, we can hit these rural areas also. Obviously, there's more cost involved with those type of deliveries, but the accessibility needs to be there, and that's what we plan to provide in RX Mile.
I love it. All right, rxmile.com is the website. Kunal Viaz, if you're on LinkedIn, he's very active on social media. I love the content that you guys are putting out. I cannot wait to hear more about the pill, and I hope you'll be on This Week in Pharmacy in an upcoming podcast.
We'll be there for sure, my brother.
All right. Thank you, Kunal.
Thank you.
ICON is the leader in tabletop pharmacy automation, delivering innovative solutions that enhance accuracy, efficiency, and compliance in medication dispensing. ICON's visual precision counting technology eliminates the need for manual pill counting, reducing human error and improving workflow. ICON ensures precise medication counts, minimizing overfills, underfills, and financial losses due to miscounts. Unlike traditional counting machines, ICON captures an image of every transaction, providing verifiable accuracy and helping pharmacies maintain compliance with industry regulations. RxSafe, known for its advanced pharmacy automation systems, enhances operational efficiency with solutions like RapidPackRx and RapidCardRx, which streamline adherence packaging. These automated systems allow pharmacies to provide multi-dose and single-dose packaging, ensuring patients receive their medications accurately and on time. By integrating automation, pharmacies can reduce labor-intensive tasks, improve inventory management, eliminate waste, and increase patient safety. Together, ICON and RxSafe are transforming pharmacy operations by reducing workload, improving compliance, and enhancing patient care. As labor shortages and regulatory pressures grow, automation is no longer a luxury but a necessity. Pharmacies that adopt these technologies can operate more efficiently, reduce dispensing errors, and focus more on patient engagement, reinforcing their role as essential healthcare providers in an evolving industry.
ATRIUMX 2025. I'm here with another mentor of mine. This is like the best weekend ever. I get to see all my people. Miss Kelly Babcock.
Thank you.
How are you?
I am fantastic.
How's your weekend going?
It is.
Because I know y'all have put a ton of work in.
Oh my gosh. Well, and listen, we haven't even been involved in half, even a quarter of the coordination and the physical behind the scenes logistics that go into putting an event like this together. And the team, the Atrium 24 team, has just been phenomenal.
Yeah.
I mean, just off the charts, done such a great job.
Yeah.
And we're just, I say we, because my partner in crime, Terry Norvell, and I are both here, and we are just thrilled to death to be here.
Yeah, when I saw the stuff come out about who's going to be there, I'm like, all right, I'm going. So my people are there. But
Hands down, yeah.
I get here and she calls it and I think you and Terry did too, the unconference.
Right. Next Gen
It's
conference.
everything except a conference.
Right. Right.
And so I don't know if we can really talk much about it without spoiling what it is for the people that aren't here, because we want them to be here next time.
Sure,
right?
Of course.
Yeah, but just give us a little highlight of what it's
Absolutely.
looking like.
I think we can do that for sure, because we know at conferences that we spend a great deal of our time talking to like-minded peers and gaining insights And the events that facilitate that are generally not when you are sitting in a conference room, big ballroom,
Right.
at a table, chained to your chair for 8 hours a day,
Right.
or running from one breakout session to the next, where you're set up in theater style, classroom style, where you really don't have the opportunity to, as Nicolette likes to say, you have presenters presenting at you,
Right.
So you don't really have the opportunity to connect in a deep and meaningful way.
Yeah.
Breaks before breakfast, lunch, dinner,
bar
at the
afterwards.
lobby bar.
Right.
And those conversations really have impact. Now, the downside to that is that you don't often have your notebook with you, or your tablet, or maybe you're capturing somebody's contact information to try to connect with them later. And how often do you get back to real life?
Right.
You get busy being busy, and then that connection sits sort of on the shelf for a while, or even if it ever gets made again,
Yeah.
right? So this conference is really dedicated to preserving and promoting those interactive opportunities where it's about you, it's for you, and the content is curated organically, which I think is the coolest aspect of the whole unconference.
You use the word organically, and that's where I was going to go. Was you all have set it up that it's organic to ask questions in the middle of a presentation,
Right?
which seems counterintuitive, but then that can make that whole presentation go a different direction, and then we kind of circle back around and we do this, and like, so your questions in your mind are immediately getting answered.
Right.
If you're, I use the word bold, but most everybody here has been very vulnerable and asking questions,
Right.
and very
Right.
responsive and wanting to answer. So it's really unique.
Yes. Well, and you used a word that I think is sort of locked in our vernacular, and that we associate with conferences, and that's presentation. So when people are raising their hand and getting their question answered immediately, it's because what we're doing is having a dialogue and a discussion and a conversation that is being facilitated. And right, so here's the thing: when you have this level of expertise in a room, why wouldn't you take advantage of it? Right? Why wouldn't you lean into that wisdom, the collective wisdom of the group? And it's amazing to see that just evolve and listen, I get it. There's a fine line between chaos and organized, organized chaos. This is actually very intentionally thought out. It's a process. It's not actually new.
Yeah.
They listen.
I heard Nicolette kind of talking about that other industries.
Silicon Valley in particular, they utilize this format, and it is a format. There is a gentleman who is considered the founder and the creator of the process. He's written books about it, and he certainly advised and consulted on this one so that we would actually get the process down without people feeling like it was too disorienting.
Yeah.
And it can be disorienting because we are all trained to behave a certain way in a conference environment. So this is really new and different.
I'll kind of, I don't know if I'm going to ruin this or not, but we all walked in day one, night one, and there's no chairs.
No tables.
No tables. We're all standing in a round just looking at each other, and I'm like, this is awesome. Because that's me.
Right.
I'm that guy. But everybody, and I could tell the uncomfortableness in a lot of people.
It was palpable. Some people actually turned around and started walking toward the door thinking they were in the wrong room, right? So I don't know, Adam, if you remember, but Terry Norvell and I, we co-facilitated advanced leadership, and on the third module, day 2 of the third module, we rearranged the room, and you walked in and there were only chairs, no tables. And people freaked out then.
Yeah.
Right? It was so disorienting. And so we just really had to put people at ease and to explain that there was a real method to our madness, that there was a purpose to this, and that, it all would become clear eventually, right? And so during the sort of the the registration process, we tried to talk to as many people as we could to set them up for success and to say, now, you're here because you're an innovator.
Right.
You're an early adopter.
Right.
You want something different. You've asked for something different, and we're going to deliver that.
Here's different.
So let me just assure you, you're not going to walk into that room and it'd be the same thing, right? We're gonna crack the egg here.
Right.
And so it was funny because I don't think people really believed us when we said, don't be too disoriented now when you go in that room, and yet they still were.
Well, I was knowing you guys, I was prepared.
Good.
But still disoriented a little bit. Like,
Right.
What is
happening?
Here we go. This is something weird
Right.
that's happening. But
right. I think you can answer this question. I think we were able to put people at ease pretty quickly.
super quick.
Awesome. Yes.
And I think also the people that are here sprinkled in certain people that you all invited or whatever, put those people at ease too.
Yes.
So, hey, I recognize this person and this one's a little bit more outgoing than me, or hey, they're more friendly. Like, I met quite a few people that were brand new pharmacists, brand new owners.
Right.
And you can tell they were out of their comfort zone. And so as somebody who's seasoned into this kind of stuff, I just immediately went to them.
Awesome.
Hey, what's going on? Hey, here, give me a hug.
Right.
You know, that kind of
Right.
stuff. And that's what I love about what you guys are doing.
Well,
here.
and the organic evolution of content is, to me, probably one of the single greatest differences, right? If you want to say, I think it's honestly the secret sauce, because being able to actively choose, like, vote on what you want to talk about.
What we want to talk about.
Right. And then to have thought leaders and experts and facilitators to guide those discussions.
And real world scenarios.
Yes. What is important to me and my pharmacy and my team and my profit and my patients. So it has been delightful to see it all come together. And I really credit Nicolette with having a different vision.
Yeah.
You know, I've known her for 11
time.
years. Yeah. And I just am filled with so much pride.
Yeah, I bet you guys.
That she is contributing.
She's like your little kiddo.
I know. It feels so good to see so many successful and innovative independent pharmacy folks, yourself included. I mean, it's just been, I don't know that there are words to describe the eudaimonia, maybe the fulfillment that I just genuinely feel to see you all just rocking it in a way that's just so meaningful for this industry, and to bring that to independent pharmacy is a really incredible thing. So thank you for your contribution.
Well, thank you for your kind words, and I mean I'm envious of that feeling that you're having, and I do get to see it some on my end too, of people that I've helped, that I've consulted with, and that have come. I had a gentleman that came up here, and he's like, "I don't know if you remember me," and I was like, "I remember your name," and he's like, "I called you one time, and you helped me completely redesign my workflow."
Wow. Yeah.
And he's like, "My pharmacy's been different from that point," and I'm like, "It took me one phone call."
Right.
Didn't even remember the guy.
It wasn't something.
I remember him now.
Sure you do. And it wasn't something out of the ordinary for you, Adam, because you are so gracious and giving. And yet I think we can never underestimate the power of the impact of our connections with other people. And that is I would say that's one of the greatest benefits of having the career that I've had, is that I get it comes back to me in so many ways that is just brilliant and beautiful, and I'm just eternally grateful.
Well, I'm super, super excited to be a part of the first year of this, and I can't wait to be a part of the remaining 50 years. I hope that it keeps going. And but if you're listening to this now, and something kind of piqued your interest, and you're like, man, maybe I don't know, it's kind of awkward sounding, but come try it.
Absolutely.
Try it next year, and I guarantee you're going to leave with something that you're going to utilize.
Without question.
And you're going to leave with a contact, 100%.
Yes.
So
Guaranteed. Guaranteed.
Yeah, so
thank
Kelly,
you, Adam.
Thank you very much. We went pretty long on this little bitty, we were just supposed to talk for a minute or two, and it's like 12 minutes in, so I'm not mad about it.
I love it.
So ATRIUMX 2025, super excited. Kelly, thank you.
Thank you, Adam.
Paul Shelton, if I show up to a pharmacy conference and there's anything to do with long-term care at home or long-term care in general, I better see your face there.
Well, thank you. That's my hope as well.
Yeah. All right. So I've known you in general, just in our crossings of the ships at night, for over 10 years.
Yeah.
And you've really dialed into a specialty to really help pharmacies, whether they're the pure player, where they're long-term care pharmacies and they're evolving, or the newest key word or key phrase is long-term care at home. And I'm fascinated by this. People like Sean Nairn, you and I have a friend in Sean, Mr. Pittsburgh. His is what was a way ahead. He was doing this 10 years ago where he was like, wait a second, I'm not going to do ACOR or ACOR pharmacy. He's like, hey, I'm going to start delivering services to my homebound patients from my closed door retail pharmacy, which was crazy. Yeah. And everybody thought he was a nut. And now, of course, everybody's looking at that saying, geez, that guy knew what was going on and the pieces of the puzzle. So here at ATRIUMX, we're talking about every subject that has come up, which has come up by the people that are attending, they're making up this conference on the fly, has been about profit, about being profitable, about implementing profit. So the future of community pharmacy is, if you don't start doing things a lot different in some ways, some things similar, but the absorption of what's happening in our communities with our home care, you're going to be left behind and leave it for a bigger organization to come in and take the pie.
Absolutely. And we talk to community pharmacies all the time, and what makes them uniquely situated to help these patients that are staying in their home is they've got that community engagement. They can very uniquely work with local providers and physicians and physician extenders to better understand the needs of those community patients and provide that increased compliance and adherence, which drives better outcomes, which is why we can increase profitability in community pharmacy with this. Because again, without the outcomes, the payment model doesn't work. So as long as we're continuing to create this as a true long-term care level of service, which is higher touch, the compliance packaging, the delivery, the monthly medication reconciliation, transitions of care management, coordination of care, that's communicating back to all these providers. It's amazing to see the impact that this can have on small town, small individuals. My chief of staff, her dad is a great example of this. He was on 27 oral solids, insulin-dependent diabetic, was in the hospital over the course of 7 months about 5 times. Post going into long-term care at home treatment, he's been 15 months in the hospital twice. And all we did was help him manage his medication better and get him on a continuous glucose monitor. It's simple. And you think of the difference in cost of care for just that one person. We're talking significant, almost $40,000 reduction year over year cost of care. And he's one of 250 patients that the pharmacy that's supporting him supports.
So I'm always a positive guy, half glass full all the time. Something that I'm concerned about is when the bigger organizations start to catch up with these opportunities and ruin it for the rest of us. There are the 16,000 independently owned community pharmacies throughout the country. So you, in the position that you've been a consultant with PharmaCare Strategies. PharmaComplete Strategies. So the whole deal with you is you've been bringing to the table how to navigate the now in order to be profitable, in order to build it. But someone like you that does pay attention to what's going on, what do you see? How do we mitigate the risks of this being taken over by bigger organizations?
Absolutely fantastic question. So one of the things that makes community pharmacy unique is that it's in the community, right? So you have these larger organizations do a mail order. They're trying to do this from either a large central fill pharmacy or a mail order pharmacy, they don't have the capacity to have that community engagement that's absolutely mission critical for this to be successful. One of the reasons that Sean and other people in Pennsylvania that do this have been so successful is because Sean's not servicing all of the state of Pennsylvania. He's not servicing the 5 surrounding states. He's servicing a 90-minute drive time or so around his pharmacy. And that gives him the ability to know every provider within that network, within that space. And so he can have those driven, guided conversations about this patient has a change in medication. Let me notify you of that. It's that taking that extra step and taking that extra engagement to make sure the physicians understand what's happening. When we look at some of these very frail, very fragile populations, they're averaging between 3 and 5 providers each. Those providers are not coordinating care in many cases. They have no idea that their primary care physician just prescribed them the same medication that their cardiologist prescribed them. Now they're doubling down on that dose. The only person that knows that is that community pharmacist who's sitting in the middle and managing this as an LTC process.
Let's talk about the pieces of the puzzle.
Okay.
So we need a pharmacy management system. We need a pharmacy management system that understands the difference between the traditional community patient, the assisted living patient, the long-term care skilled patient, or whatever you're going to call it, however you're going to label. We want to execute ancillary or additional orders on the fly so we don't have to sit there and nitpick, and being able to maybe gauze or a cane or DME or whatever's happening in that home. So that's the pharmacy system. We're talking about remote patient monitoring technology. We're talking about a billing setup, and we're talking about compliancy. Can you list off kind of some of the list of things that I should be thinking about as a pharmacy owner in order to really bake this cake?
Absolutely. So let's start with the most simple one-layer cake, right? So you got your one-layer cake. You need a prescription management platform or pharmacy management platform that can differentiate between retail reimbursement and long-term care reimbursement. Nice. On top of that, you're going to need to have the ability to provide compliance packaging and provide delivery to the patients and also capture a proof of delivery. So we're seeing a lot of audits around, okay, well, we say you said you delivered this, but who'd you deliver it to? When did they receive it? So that's kind of the very most basic model. Okay, you also have to have after-hours monitoring, so you need to have an answering service. You need to have access to custom compounded medication and IV therapy, and so that, again, can be done through contract. So that's your very most basic model. When we see this implemented well, we see a fundamental shift in the way the pharmacy is operating. The pharmacy stops thinking of this as something that's happening on the back counter for 25 or 30 patients, and we start thinking about it as something that this is the new way to provide pharmacy for any patient that's taking 5 or more medications in my pharmacy, whether I get paid for it more or not. Fundamentally shift that. You can have, in many pharmacies, as little as 30% of your patients make up 80% of your volume. And all of a sudden, you have a much leaner, much more proactive model of pharmacy versus the current retail model, which is I'm waiting for someone to walk, click, or call into my pharmacy. So I have to staff for what's the biggest day we could have. It's always Monday. And so I'm carrying an extra person for the rest of the week. In a proactive model, I'm picking the phone up and calling the patient. I'm having that engaged conversation, understanding what their needs are. In a proactive technology-enabled model, I have remote treatment monitoring with either a box that's monitoring the strips coming out of a package or something that's monitoring me opening the blister card that I'm providing for them, or something that's monitoring even something as simple as the vials that I'm providing for them. And I'm getting that feedback back at the pharmacy. I can see they're being compliant, and then I'm also providing that to someone who can bill that for me through medical billing and provide some feedback or provide some reimbursement back to me. On top of that, there are automation processes that you can utilize to reduce your labor for fulfillment, and then also automation processes you can utilize to actually automate the inbound prescription volume and automate the outbound volume. So you're receiving phone calls. You can literally have AI now that can answer 40 to 50% of your phone calls if you have a high volume call center. I mean, the layers of the cake just keep going. And there's so many things you can do to reduce labor, and that's really what it's going to be about. It's about increased quality of care, get your labor to as tight a model as possible, and have the right people in the pharmacy to provide health care, and at the same time in your fulfillment center, have an excellent manufacturing process.
All right, so I don't know where the majority of our community pharmacies are at, Well, how do I get started? I'm listening to the podcast. I heard about the ATRIUMX, event. I didn't get to attend. I'm now listening now. Give me a blueprint of getting started.
Absolutely. So the first thing is, let's determine whether or not this makes sense for your pharmacy, right? You reach out to us at the Long-Term Care at Home Pharmacy Network or the Pharma Complete, either one, and we have the ability to provide some feedback based on claims data about whether or not you actually have long-term care at home patients in your pharmacy. Okay. Now, I can pretty much assure you, based on our 160 of these assessments that we've done in the last 3 months, every single one of them has returned information that there is, in fact, more than $1,000 worth of value in every single one of these pharmacies that we've reviewed. And that's remarkable. Those are more than $1,000 of home and community-based patients. Those are waiver patients that are automatically qualified for long-term care at home. Then there's high propensity. We're averaging about $4,000 a month in opportunity in the high propensity column, which about 50% of those patients are going to actually qualify. So we're seeing tremendous value across a large number of pharmacies that we've been able to do this assessment for. So first step, determine, do you have opportunity? The answer is probably yes. If you do, the next step is you need to select a GPO PSAO partner for your long-term care reimbursement. You'll go through the process of getting a new NPI, so a second NPI that's primary taxonomy long-term care. Then you'll get a second NCPDP, and then roster that with your GPO partner or PSAO partner. Mm-hmm. Once that's done, they're going to roster you with ATRIUMX, and then you'll fill out a paperwork. It's a simple application. Takes probably about 6 hours or so to get all the data in there. Obviously, simple being a joke. It's for Express Scripts, and that gets you rostered with Express Scripts. So right now, Optum and Express Scripts are the two PBMs that pay an increased reimbursement for long-term care at home. What's interesting, though, is when you start layering in remote therapy management, when you start layering in the better processes, even if you're not getting increased reimbursement from the other two major PBMs, putting their patients on this process still makes sense because it's lower cost to fill, higher touch for the patients. The patients have a better engagement and, frankly, better outcomes. And so the goal there is by the end of this year to have those other two PBMs recognizing this as well because, again, the positive outcomes. So that gets you to the point of being able to actually set this up. That whole process from start to finish takes somewhere between 90 to 120 days. Most of that is waiting on the PBMs to get you rostered with them and set up.
All right, give your website to the listeners again, just in case they didn't hear it.
Yeah, absolutely. It's the Long-Term Care at Home Pharmacy Network is ltcah.com. It's the easiest one to find, and then Pharma Complete is pharmacomplete.com.
Paul Shelton, we always appreciate your insights, and we'll be chasing after you for a new series that we're going to be doing on long-term care at home. So stay tuned to hear more from Paul Shelton on the Pharmacy Podcast Network.
Outstanding. Thanks so much for the time, Todd.
Nick Brook, pharmacy. Are you a pharmacy owner?
I am not a pharmacy owner.
Why did I think you were a pharmacy owner?
I've heard that quite a few times, and it's honestly very humbling. I'm definitely not a pharmacist. I'm not a clinician. I hated going to school, left to college as quick as I could, but I've always been on the technology side of the industry.
Well, tell us what you're doing now, because ATRIUMX is a very special gathering. It's the first of its kind where we're putting content together at the time of the event. They're going to be gathering all of the pharmacy owners and saying what's the most important thing. But tell the listeners, how are you plugging into this?
Yeah, it's a great question, and to that point, it's so exciting to see all the thought leaders here and everything that they can offer, and their generosity in offering all those ideas and solutions to the broad group. I think it's just incredible, and such a fresh of breath air coming from the traditional conferences that are so sit down and buffet style. We're going to shove you the content down your throat.
Yep.
So as it pertains to myself, I'm really a thought leader around Medicare optimization.
Okay.
Specifically around Part D. I worked at AmpliCare for many years, built a lot of their DAR reimbursement insights, specifically around finding win-win opportunities where patients can save money and pharmacy can improve their profitability and retain that patient. So I spent a lot of time looking at pharmacy contracts, how they're contracted in the Medicare space, and it's great when we can align stakeholder incentives. Every patient wants to save money, and most patients do save money when they look at their Medicare plans. But most importantly, aligning that against the pharmacy and what plans happen to reimburse them better, more effectively. what plans can they set up with medical billing on the Medicare Advantage side, where they can be providing like CGMs and other great tools, whether it's diabetic or other disease states. So from the work that we've done, we see that the average patient saves about $900 on their prescriptions. For diabetics, they're actually saving around $1,100, with some plans covering continuous glucose monitors and supplies at a much lower rate. And then on the pharmacy side, we're seeing about an average profit increase of about $1,000 per patient. So some great results, and yeah, absolutely willing to share everything with anybody.
So when I think of what you're doing, are you going to individual pharmacies? Are you going to large pharmacy buying groups in order to educate? How are you getting the messaging out there to help independent community pharmacies take control of their own destiny?
Yeah, absolutely. So, it's a relatively new endeavor. Started at this past summertime, and really this past year I just worked with my pilot pharmacies across a handful of states.
Okay.
So after that now, scaling it to the masses this year and the years to come. I collaborate still a lot with my friends at AmpliCare. Very recently did a webinar with them to the CPA membership around Medicare Advantage open enrollment period that's happening in Q1.
Okay.
Might do another one around dual-eligible patients and D-SNP plans, and what patients are good fits for those kind of plans, and how you can identify those opportunities at the pharmacy counter, because so often patients are coming into the pharmacy and they are bringing them issues that at times can very quickly be resolved with an insurance chain switch.
Okay.
That can also really help the pharmacy bottom line as well.
But tell the story for a second. So take us through a pharmacy owner that's listening to this right now, didn't get to attend ATRIUMX.
Mm-hmm.
By the way, you missed out on a really amazing event. Be here next year, ATRIUMX 2026.
Ooh.
Anyway, so tell the story. The patient walks in, and then how do you engage that patient for the right situation to get them involved with what you're doing?
Yep, so it's a mix of pre-identification and then post-identification. So definitely do a lot of work before the patient ever comes in the door on, hey, these are the patients that we know are on a suboptimal plan for them and for you. And that's really where pulling through the pharmacy data becomes really paramount.
Yep.
Because we're trying to find those win-wins, and we know that, hey, you might have 1,000 Medicare patients, but these 50 or 100 are going to be the ones that we really want to try and speak to, because we know it's a no-brainer. They're going to save a lot of money, you're going to make more money, everybody wins, everybody's happy. That's the true definition of a win-win. On the opposite side of things, when you're looking at really identifying that at the pharmacy counter, you're looking for certain trigger words, particularly at the start of the year, where patients are complaining about medications not being on coverage anymore. Oh, this medication dropped off my formulary. Or they're complaining about cost. Or certainly they could be complaining about the diabetic supplies. That's something that worked really well for us in the state of Pennsylvania this past year. Was learning that one plan in particular could cover continuous glucose monitors at $0, whereas the other plans, it was a 20% co-insurance if they had a specific condition, or was just 100% out-of-pocket cost.
Okay.
And the viability of the CGMs is so much higher. The patients love them, and working with the pharmacy there, they knew that every time that patient came up, whether they were giving them a CGM and there was a copay behind it, or that patient was complaining about the cost of the CGM, that instantly became an opportunity for us to look at that patient's profile and say, does it make sense for them to switch their plan? Do they have other factors that go into it that, are only gravy on top of that?
I would think that Omnipod and Dexcom would want to partner with you in some way to take advantage of the marrying, because you're marrying an opportunity. You're taking the community pharmacy, they got the data shows the patient who is candidate for this program, and now we reach out to Dexcom or Omnipod and say, hey guys, do you have a rebate? Do you have something I can help market? Talk to me about that, because my ears are on fire, because I'm going to follow up with you with RxPR, which is a business development and PR agency. We should get behind you on the whole thing. But kind of spell that out so that our pharmacy owners are like, ding, 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 holy cow, here's an opportunity for me.
Yeah, it's a really, really interesting point.
We're going to have to build it. We're going to have to build it. Hey, you just heard on the fly a mastermind opportunity between me and Nick of what we're about to build. So you better pay attention if you're listening to any of the Pharmacy Podcast Network shows. here at Atrium. That's what ATRIUMX is. It's on the fly ideas, right?
Right here, we're brainstorming in the live.
The live. Nick, I swear to God, I'm going to reach back out to you. Got to have you back. I'd like to bring you into the Pittsburgh studios and just once in do something like this, and let's vet this out. Let's get a couple pharmacy owners in the studio with us and really talk about how do we make community pharmacy more profitable, especially based on some of the tools and programs that you're bringing to the table.
Yeah, I would love that. I would be there in a heartbeat. And there's a gentleman in Pennsylvania, Bob Hinkle, I do a lot of work with at Johnson's Pharmacy out in Hazleton. And he's the one that we really lined up that CGM program with very nicely.
All right, let's do it.
Gangbusters on it.
Nick, thanks for being part of the ATRIUMX post show.
Thanks for having me. Todd for the win.
Hey, ATRIUMX 2025, the inaugural. We're here, and I'm sitting here with Austin Murray, who works with the Pharmacy Podcast Network with Sykes and Company. This is a fun event to be at, Austin, when it's the first of its kind.
Yeah, absolutely. Anytime you have a pioneer kind of event like this, that's first of its kind, it's always really interesting to see what are pharmacy owners interested in? What are their specific pain points? What are the problems that they're trying to solve? And I love it.
Well, one of the things that I found interesting about this conference is there was no specific agenda.
Right.
And Nicolette Matthey and the team are waiting to cultivate and come together and have the participants decide what's the most important things happening in our pharmacy profession? What should we all be talking about that really makes sense? Let's get away from the traditional way that conferences do things, that are the agenda set, the speakers are picked out, and sometimes the content isn't as relative as something that is mastermind into existence.
Yeah, you kind of, it's interesting you bring that up because I think we live in a world now where there's a lot of information out there. There's a lot of different choices that you have. And I think anytime you can kind of make something a little bit more personalized for the consumer, I'm all on board for that. And I think, especially an event like this where the pharmacy owner is literally curating what they want their experience to be like. I think that's fantastic.
So one of the challenges that I see from afar, I've never owned a pharmacy, didn't operate a pharmacy. I'm not a pharmacist. You're not a pharmacist, but I've been soaking in pharmacy for more than 20 years. So I see things from a different perspective than the user or the operator does. And something that I'm encouraging all the listeners listening right now is how powerful your stories are, how powerful your successes are in your community. You and I constantly talk about, because we're content development nerds, we always talk about content development. Let's talk about right now, for the listeners of the podcast series, why is it so important to dial into your specific sector, your specific expertise, and even your specific community with custom content?
Yeah, it's an interesting question. I think, the reasons for it, there's many different layers to it. Quite frankly, anything that you can do to position yourself as a thought leader, anything that you can do to position your brand as specific to that niche. When you think about marketing, and if you're reaching kind of a broader audience, your message isn't gonna be as sticky to the listener. Whereas with independent pharmacy, you can go really niche. So you can do independent pharmacy in general, or you can go even tighter and do independent retail, independent long-term care, independent compounding, which is a lot of like the content that we're kind of doing now at Sykes. Is we want to focus more on, hey, how can we reach more independent long-term care pharmacies? How can we reach more independent compounders? And some of these pharmacies, they do a lot. They do a lot of overlap where they'll have compounding, and then they'll also do long-term care as well. And so that's kind of what we want to do, is we want to take our audience, segment it down, and focus on how can we create custom content so that way it's just an easier and it's more educational for the consumer.
It is, and Austin and I are talking about a B2B environment where our businesses, Sykes and Company, Pharmacy Podcast Network, RxPR, is reaching out to other businesses to communicate better with, let's say, privately owned pharmacies. But I want to make another point. You pharmacist owners out there that are listening to this podcast right now, you don't realize maybe, or you might forget because you're just so busy, that your community is in a time of information overload, and sometimes they have no one to trust.
That's right.
Because even our federal government administration is in a crazy time of flux, and things are very, in some ways, from a consumer's perspective, extremely destabilized. So who is the healthcare trusted provider already, embedded in the community, has the community's trust already? There's been the Maple Street Community Pharmacy for 25 years. You have an opportunity to educate and to get between the false and the fake news and the Dr. Google and really deliver good content to your community, specific to your community, not anything canned. And organizations like Sykes can peel that out of how do we do it from an accounting perspective and best practice, and how do we teach you to do things in steps. But you and I, Austin, are content developers, and I think of my organization and thinking, well, how can we pass on some of that to our community pharmacy, independent pharmacy owners? I like how you broke it down. Long-term care privately owned, specialty pharmacy privately owned, community privately owned, and now this new segment that's getting a lot of attention, long-term care pharmacy at home, and treating a home as a extension of a facility or an assisted living facility. What do you think of trying to take what you and I know and somehow pass it on to our customers?
Sure. When you think about content, going back to what you mentioned about content development, what I like to think about is, most people are inundated with content all the time. Content is everywhere. And so if you can, I like to think of it in terms of topics. There are certain topics, there are certain pain points that people are dealing with. And if your solution or if your marketing isn't in the top 3 pieces of content or topics that they're thinking about whenever they wake up, then it's not going to resonate. It's not going to be as sticky. So what I like to do is I like to say, okay, what are our content or topics that we have in general, and how can we bucket that out? For a pharmacy, this might look like, taking some of the pain points that your current customers are feeling, and breaking that down into more specific subtopics. So, let's say, for example, somebody might be dealing with a weight loss issue. Well, we can take that weight loss issue, especially with the GLP-1 situation that we have, and we can break that down into we can layer it into tons of different pieces of content just off of that, using those different topics. And you mentioned being more ingrained in the community. What that does is, when you're putting content out like that, that makes you stickier within
that specific area.
Right.
So a shout out to our community pharmacy owners. You probably are thinking, I don't have time to develop that content. That's why there's organizations out there like GRX Marketing and Dispense Marketing and these outsourcing organizations that are ready to work with you to dial into your specific community. And if you start using hashtags of your city, if you're like hashtag Austin or hashtag Butler or some city, and people find that community will pay more attention to that custom content because it feels more like it's their content. It's something that's been developed specifically for them. And I want listeners to think about that, customizing your content, customizing your marketing, realizing the impact that you're making with being trusted. And then, of course, I want you to take advantage of headlines. I want you to think about this. If something's happening in the news, it's best for you to get on TikTok or get on Instagram or get on Twitter X or get on LinkedIn or whatever your favorite platform is. Get one of your pharmacy technicians to help you. Reach out to GRX Marketing or Dispense Marketing or whatever, or even reach out to us and be like, okay, I'm going to make content that's based on the headline, big headline news. They're seeing it at the Wall Street Journal and USA Today. Make a comment on it and then draw it back to your pharmacy, draw it back to your expertise. And now all of a sudden you have phone calls coming in, people are walking into your store saying, hey, I saw you comment about the measles vaccine, right? That's hot right now and being talked about. Mm-hmm. Well, give them your opinion and give them the testimony and give them a vaccine, for God's sakes. Do something at that time that engages them, but don't lose an opportunity to engage your specific community with customized content that has everything to do with the current events of what's going on.
Yeah, and go back to what you said about content. Another way to kind of think of this, a lot of pharmacy owners, they're really busy dealing with patients, really busy running the pharmacy. They might not have the time to film like a 30-second or a 1-minute reel. And the way that I like to think of it is building more of an infrastructure. So take a piece of like long form content, for example. It takes maybe an hour once a month, and you can chop that piece of long form content. So let's say you did like an hour webinar or an hour podcast for your local community on the GLP-1 topic. Mm-hmm. You can break that podcast down into 3 different topics, and that 1 hour podcast is enough content for a month, 2 months, 3 months.
Exactly.
And then you can also repurpose that content. So let's say, for example, you've also got that same episode, you've got the short form versions of that. Well, then you can also take the transcript and you can create things like engaging carousels, engaging static posts, things like that as kind of filler in between content as well. And it's still revolved around the same topic. And so, as we're in this kind of one of the era that I like to say that we're in marketing is we're in this era of personalization at scale. Yeah. So we're in this era of how can we personalize things for consumers, things for potential customers, and in a way to where we're not spending a ton of time and a ton of effort and money investing in all this. How can we personalize things for our consumer in a way that is actually scalable? Yeah. One of the ways you can do that is through content and creating a nice infrastructure.
So I want you listeners to really understand something. Sykes & Company has been around for how many years now?
45.
And it's all been focused on the survival and the thriving of our community pharmacies or independent pharmacies, but they're branching out into other sectors of pharmacy. They have such an understanding of what's happening in the markets. It's so personalized, just like we're telling you that you need to deal and dish out content to your community that is personalized. Think about the infrastructure of your money and of your cash flow. These are the guys to reach out to. They get it. And then people like Austin are going to sprinkle in other things to expand your business when they get talking to you and account management and things that they're doing. We appreciate your support of the Pharmacy Podcast Network. Austin, we like being here with you at ATRIUMX. And we can't wait to work with you in an upcoming episode.
Yeah, I love it here. Thanks for having me on.